Hello, everyone. Thank you for joining our latest Lilia AI webinar. We are privileged and honored to have a very special guest here today with us, Dr. Aaron Cohen-Gadol, who's a world-renowned neurosurgeon, scientist, innovator in medicine and healthcare AI, and a world-renowned leader in medicine as a whole. And I can say personally, for the last decade, he's been one of my biggest role models and mentors, and a great example, for me in becoming the person and the professional that I am today. And Dr. Cohen's CV is too long to go over, in just one webinar, but he is founder and president of Atlas Meditech and the Neurosurgical Atlas. The Neurosurgical Atlas is the world's leading neurosurgical education platform. It's considered the Bible of neurosurgery, and he's also the head of the Atlas Institute of Brain and Spine in Los Angeles, California. He's associate editor-in-chief of Neurosurgical Focus in the Journal of Neurosurgery, and he is a board member and feature editor of the World Neurosurgery Journal. And again, we're very excited and honored to have him with us, and looking forward to learning more about what Dr.
Thank you, Ali. Thank you, Ali. Very grateful, very proud of what you have done, Ali, and all of you guys. So looking forward, hopefully, answering some questions that are useful to some of your audience.
Absolutely. And so to get started, do you mind telling us a little bit more about the Neurosurgical Atlas and what got you started with it and how that's doing nowadays?
I started when I was a resident, started at Mayo Clinic in Rochester, Minnesota. And I saw that so many people train with people who train at the same program. In other words, their attendings train at the same place they're training. And there was very much little cross-pollination of information about technical skills. There were so many great ways things could be done, but neurosurgeons never communicated with each other. It's unfortunate that I think part of it is tradition, part of it is ego, part of it is just the way things are in neurosurgery. We're in silos. So I always thought it's a great thing to video your cases and send it to others. And also, one of the great reasons Neurosurgical started is because I took on really difficult cases early on in my career and got into trouble and got myself out of trouble pretty quickly. And I thought those are the great teaching points of neurosurgery, or the practice of neurosurgery, because it's not all about the case going well. It's all about how you get yourself out of trouble when you get into trouble for reasons that may be out of your control. However, those are the times where you make the biggest difference for the outcome of the patient. So I started videotaping cases, how I got myself out of trouble, started sharing it with others on a small website, and it became extremely popular. People really love to see somebody else get into trouble and watch to see what happens. It was almost like watching a Indy 500. You want to see, well, who is going to get in trouble and what's going to happen. It's like almost become, unfortunately, an entertainment. And then eventually these videos became more and more and more, and people got interested and started writing chapters and did 9,000 illustrations and really grew from there, most of it because I videotaped my own cases to watch them later and learn from myself. And because I thought the best way to learn is watch yourself operate. It's very difficult to learn when you're doing surgery and you're in the heat of the moment, but it's much more feasible when you have videotaped your case and now you have time to sit down and learn. So I would say the greatest factor in my career to become a better surgeon was watching myself operate. I would edit out the part of the surgery that was really doing something that was deliberate. And then I would watch the rest and I was amazed how inefficient I was. I wasn't amazed watching other surgeons how inefficient they were. And it was just an extremely revolutionary sort of wake-up call. And we started doing cases, and every case we took more of those undeliberate, ineffective movements away and make the surgery more efficient and more efficient and more efficient. And by the time, 10 years later, and this goes back 10 years before now, in fact. So 10 years after I started, we just were doing surgeries 20 times faster, 100 times better results, and the patients were going home faster because we could do the same thing in 1/20th of the time with better results. And all of that was because I took an initiative to sit down and learn from myself, from other surgeons. Really, I asked for anyone to send me videos. I also was involved in Journal of Neurosurgery for being reviewer for videos, and so watched a lot of surgeries. I mean, combined, I think in my career, the past 20 years, I may have watched something over 20,000 hours of surgery. So by now, I can potentially tell you, I'm very good even watching a video for 15 seconds or 20 seconds and tell you which country that surgical video comes from. That's how good I've become at this.
Yeah, no, thank you for sharing that. It's certainly, I mean, amazing story and amazing resource for neurosurgeons and neurosurgical trainees all over the world. To kind of learn more about your background, what got you interested in neurosurgery?
Yeah, I will finish back about Neurosurgical Atlas now is used in 130 large institutions across the world, major hospitals, over 70,000 members. Really a big deal. Um, and so it really has become almost a movement. There are so many people that really have adopted a different surgical philosophy of efficiency and simple, clean, and efficient surgery. Getting away from all those, some of those, what you call, you know, um, unnecessary movements that are just entering our profession, not because they're effective, just because they've been passed along as a tradition. Do you know what I mean? They're there because we think they're the right thing, but nobody ever evaluated. Are these the right thing to do? Neurosurgeons are really extreme people of habit and tradition, and therefore I really try to reassess how we do things and come from a refreshed perspective. That's how really we got where we are. But anyways, how I got interested in neurosurgery, it goes back. I came to this country as a refugee from Iran in 1988. I was 18 years old, came here as a legal immigrant, went to Vienna, got my visa to come here, and then went to San Diego, went to medical school at USC, and went to Mayo Clinic for residency, did a couple of fellowships, one at Arkansas with Dr. Al-Mefti. At the time, he was in Arkansas, University of Arkansas. And so when I came to this country, I knew the value of hard work, as many immigrants do. And I wanted to do something special, something that challenges and really pushes my boundaries of me being more contributory and really put my passion into a pathway that I can help others. I was interested at some point in OB-GYN because my uncle is OB-GYN. Became interested in cardiac surgery because I was mesmerized by the function of the heart. And then they ended up watching an aneurysm clipping, ACOM aneurysm clipping at USC. And I was really intrigued by how it works and the art of microneurosurgery and operating on a microscope. I saw a lot of brain retraction. I saw a lot of ways we can improve things. And therefore, I thought, you know what? Brain sounds intriguing. It's unexplored. Brain surgery is really high risk, has a lot of potential to improve it. And that's how it all started. I became interested and went to neurosurgery and really picked up cranial surgery and then went to Indiana, then spent many, many years doing extremely difficult cases and pushing the boundaries of what I thought was possible. And I always say, becoming a great surgeon, not everyone can become a great surgeon, no matter how much they try. What I have learned is that there is something you have to be born with. There's something inherent that I see in those great surgeons that either you have it or you don't. Anybody can become a good surgeon, but very few can become a master great surgeon. It's just not by hard work. There's something more into it. If you look at great athletes, Michael Jordan, Michael Phelps, I mean, these people just had something more than just being bright, very motivated, passionate. They had physically something that, Michael Jordan was just the perfect height, 6'6" or 6'7", with a giant wingspan, very light. I mean, if he was heavier, he could have never become who he is. And he was extremely talented. I mean, Michael Phelps has an extremely unusual ratio of his thorax to abdomen to oxygenate in water. So they were born with certain inherent skills that very few people are born with. And then you have to overlay that on top of being extremely motivated, being very bright, very driven. Therefore, very few people are reaching those peak of excellence, or what we call peak of performance.
Thank you for sharing your background, and certainly, I look at you as somebody like, the Michael Jordan of neurosurgery.
Thank you.
I've told you that before, and
Thank you.
and so with all the work that you've
Yes.
done in neurosurgery, particularly from an innovation perspective, could we learn more about the work you're doing with large language models and AI and really innovating at the forefront of AI in healthcare?
Yes, thank you, Ali. Artificial intelligence is going to transform. It's the third industrial revolution. Unfortunately, most people don't realize that, and the doctors are really the classic example of those who are always sort of questioning in the curve of evolution of innovation. They're always questioning. They're the last people who join the crowd. They're always those, people that don't want to take the risk. But let's be honest, AI would transform everything. AI would transform and replace most of the diagnosticians. AI would transform surgeons. In many ways, it would take longer because of the haptic feedback, but there's absolutely no question AI would change all of us. I think the best way we all have heard, they say, a doctor who is using AI for sure will replace a doctor who isn't. That for sure is clear. That I can guarantee you. So knowing AI is so powerful, and I love technology, and I know you have done a beautiful work with your company, Lilia AI, with vascular and aneurysm detection. What we have realized is that we either want to sit on the sideline and have other people make a decision, or we want to be proactive. All the residents who work with me, they all know I repeat this statement many times. I said there are three groups of people on this earth. There are people who watch things happen. There are people who make things happen. And there are people who wonder what the heck happened. Most physicians are in the latter group. They always wake up to this idea, what happened? And they're all curious, why weren't we part of it? Well, because you didn't participate. But at the time you ask them to participate, they're like, nah, this won't happen. Don't worry about it. We physicians are the gatekeeper. Well, we aren't anymore. We don't keep any gates, to be honest with you. The government makes all the decisions, as you know, for us. And we have lost our authority because physicians don't stick together. And because of that, the idea of just sitting on the sidelines saying, well, it won't happen, for sure it will happen. And I think AI is a classic example of that. I think there will be less than 2 years or even less than a year that there will be an AI model that will be board certified psychiatrist and will be able to independently practice psychiatry. And then other ones will follow pretty quickly. It's only a matter of time. So we started Atlas Meditech. Atlas Meditech is an AI system, agentic, that uses extremely complex retrieval augmented generation, where we use private data, peer reviewed, not just anything ChatGPT can scrape over the internet, and provide extremely deep answers to physicians. That is zero rate of hallucinations. So extremely trustworthy, validated by clinicians. And we just are about to launch the one for nursing. And it's really a product by physicians for physicians, Ellie and Adam. And we're very proud of it. We think it's going to be transformative and it's going to be a great co-pilot for physicians. Nobody wants to replace physicians. We want to help and support them to do better. In fact, when we gave our model, it's the only model in the world right now, 100 of the most difficult New England Journal of Medicine cases that are enigmatic, Atlas was correct in 90%. The clinician was correct in 20%. And we're able to save $500 with less testing per patient. I mean, this just tells you that questioning the power of AI is just not a sound decision going forward.
Absolutely. It's really exciting to hear about the work you're doing with Atlas Meditech and this AI co-pilot solution, which certainly can provide huge value to physicians and help patients and do better
Thank you.
care. So just to wrap up our very interesting discussion, uh, for the next generation that
Yes.
coming into medicine, I mean, you
Yes.
mentor so many people in medicine, including myself. What advice do you have for them?
Right. Medicine has really changed, Ali, since I started medicine. We've talked about that with you many times. And I've encouraged people to really reassess if you want to become a doctor. I really have. And I don't say that because I don't believe you could not become a great doctor. I think you could be an amazing neurosurgeon, Ali. I think everybody can be very good at what they do. The question is the price worth it at this stage with all the changes in AI and medicine, all the budget cuts in the hospitals, all the layoffs, all the lack of authority? There's so many changes that are happening in medicine that is a train hitting station, and whoever stands on the way is going to be really hurting. So I think it's time where people who are really interested in medicine reevaluate how they want to contribute. It doesn't mean they have to become a doctor. I think you're contributing significantly by what you're doing in Lilia AI. Early detection of disease using advanced technologies, putting a business around technologies that are critical for success and improvement of patient care. I think that has a lot of value. I think if one person wants to contribute, and the best advice I have is maybe get your MD and then enter AI or computer science and be able to contribute that way. Just because you have become an MD, you want to do residency and just practice clinical medicine, I think that has changed a lot. You really have to recalibrate your expectations. Most physicians these days are employees. They're told what to do and they have to do it. So if that's an area that really excites you, more power to you. Please, please do it because we need physicians who can work in those environments. And our patients need them. But if you're an entrepreneur and your independence is important to you, I think going into the business of medicine using technology, AI, especially image AI, which is lagging behind chatbots, is an extremely exciting part of medicine. That's personally, if I had to go tell my kids or my daughter or son, we're very young right now, I would say If you really want to contribute to medicine, get your MD or not, but go to a part of medicine that you can contribute using computer science or other aspects of artificial intelligence. If you're really happy being a doctor as an employee and just taking care of patients and knowing that you're okay working in a corporate world as a very much an employee model and you drive satisfaction from taking care of patients, all power to you. Please do that because that's, a doctor model that we need right now. However, you have to realize that you will not have significant freedom of choice. You will not necessarily have any of those capabilities last generation physicians had. But we need doctors. We need people who take care of our patients. And there are many people who are okay with that employee model. But on the other hand, if you're an innovator, if you're an entrepreneur, you have to take huge risks. You're no longer an employee. You have to do great things. You have to raise money. You're going to make mistakes. You're going to lose. People are going to tell you no everywhere. And so it's a hard road ahead. It's a very hard road ahead. So I don't say one is significantly better than the other. I just say that you have to choose your battles. But most importantly, you have to calibrate your expectations. You can't say, oh, people told me as a physician I'll be an employee, and it's really going to be very much a corporate medicine practice. And then say, I don't think so. When I go in there, I'm sure I have a lot of freedom. These people are scaring me. No, we're not scaring anyone. I mean, we're scaring you become an entrepreneur as well because it's a minefield. It's just please know what you're getting yourself into. Don't expect when you become an entrepreneur, get afraid of risks and say, gosh, why did I do this? Or go become a doctor and lose a fair amount of freedom and say, gosh, I wish I was an innovator or an entrepreneur. Look how well they are doing. That's again not really common. I mean, 90% of they call it venture because venturing has 90% chance of failure in entrepreneurship. So what I ask everyone is to learn what they're getting themselves into. Spend time, if you become an entrepreneur, spend time with you, for example, with other people, and learn what it takes to do what they want to do. They want to become a doctor, the traditional sense of a doctor. Go to the hospital, talk to physicians, go deep, and make a decision because it is very difficult to change afterwards. And it's very disappointing, extremely, when you become disappointed because your expectations were not satisfied. So medicine is an extremely complex world right now, extremely complex. And there are great options besides medicine. Some of my smartest friends have not gone to medicine. They're extremely successful. So look at medicine not just as a way to prove yourself, but as a way to drive satisfaction in what you do.
Yeah, thank you, for this very thought-provoking discussion, and this all the points you made were very intriguing, and hard for me to disagree, with the points you made because the world is changing, healthcare is changing, and part of what we're doing, is helping drive this change, and so really appreciate
No
having.
problem. No problem, Ali. And I'll add one last thing. I know you want to make this brief, and I appreciate that for the viewers. I think the future of medicine is bright as long as you have your expectations set. I think the future of entrepreneurship is extremely bright. So just be able to realize which one matches your personality. And remember, we have to pre-write a resume. Imagine what makes you happy at age 55. It's very difficult, and make a decision based on that right now. This is the challenge ahead of you. It's very easy to make decisions when you don't have a family or kids and it's all about you. Then you only make a decision that's right for you. But that's wrong. You have to make a decision as if you're married, having a family, and you're making a decision for who is with you and what makes you successful. So pre-write your resume. Always be a leader and an entrepreneur in anything you do, even if practicing medicine. And remember, being a doctor is a privilege, not a right, which many people almost take granted these days. And the doctor's power has significantly eroded. So it takes a lot more for us to prove ourselves than what you used to be like. You walked in the hospital and you were an MD and people felt, you're a person who can make big decisions. These days, those have changed. We have to prove ourselves. We have to obey with very guidelines and really more of a corporate mentality, working at a corporate level as an employee. Those are critical aspects that are real and really have to be analyzed carefully.
Absolutely, great points as well. And again, really appreciate, all the insight and experience and wisdom that you've blessed us with, during this
Same
webinar.
here.
And
Adam, do you have any other questions?
Yes, sir. Nothing else from me at this time. It was an honor to, get to meet you and hear about your background, everything you got going on. It's
Yes.
exciting for me.
Yes. I'm very proud of you guys. I think the future of entrepreneurship medicine is in great hands and just need to push hard. The hard work is the toughest part. They don't give us things like they used to, so you have to work a lot harder to get what you used to get. So, keeping that in mind, believing in your mission, believing in your mission. What is your mission in life? And pushing your passion to be the best at what you do. I think those are the keys to success. Don't expect people to put it on your plate. Nothing is going to happen easily. If you look at any history of people who have been the greats, like Steve Jobs, Elon Musk, great neurosurgeons, they had to go through a period of an extreme difficulty, challenge, risk, proving themselves, many times doubting themselves that this would ever happen. And unfortunately, these days, if they went through it once, it seems like we have to go through it multiple times in our careers. It just seems like it's a never-ending process. I look at life, and somebody told me this, and I really like for you guys to keep a perspective on this. Life is like a stock market. The curve of the stock market comes down, goes up, but slowly goes up, eventually goes up. Every time you go from one peak to the other, you have to drop. There is no way to go from one peak to the other peak in a linear fashion. So anytime you have to be better, you have to have a significant drop in your quality of life, in yourself, in your happiness, in your family. Almost every time when you're at a peak and you are doing great, to go to the next peak, you have to come down. And that's the pain associated with greatness. Can you tolerate that hard time? And when they ask, what is the ultimate key for success? I always say, can you get outside of your comfort zone? Can you get to that valley? Can you go from your peak to the valley to the next peak? Because there's two pain points. One pain of coming down and a much harder pain of going up. And that valley can take a while. So most people say, you know what, I'm at my peak, I'm going to stay where I am. I'm not foolish enough to go down and valley, and God knows if I can make it up again. But unfortunately, that's the rule of life. For you to go from one peak performance to the other, you have to go down, stay down, unknown period of time, and then come back up. The coming back up is going to be the most difficult part. Hoping that the next peak would be higher than the last peak.
absolutely. I mean, you were one of my first role models on what it means to, achieve something great and greatness. And this mentality is something, I've tried to learn from you as well. And so you articulated it so well, and really appreciate again, all your wisdom and insights. And of course, really excited to see all the progress.
Thank you.
You're
Same
doing.
here. Same here. God bless all of you guys. Thank you for the great work. Ali, Adam, and Anu Hadi is there too. I haven't seen his picture, so thanks for being here, Hadi, as well. And eventually, I wish you guys great success with your company. I hope I can see you do your IPO and see great things from you guys, Ali. So keep up the good work.
Appreciate it. Thank you so much, Dr. Cohen. Really
Take
appreciate it.
care. Have a good afternoon.